I'm absolutely thrilled to welcome our two speakers and to kick off our final didactic session of Implementation Science Reading Course 2025. This is the third year of the reading course since the Center for Dissemination and Implementation Science was formed, and the seventh year of the reading course overall. And we cannot believe that another year has come and gone, where it's such a delight to be with you all and to have this opportunity. Today's session is all about implementation process and design. So you've learned all the elements of the logic model. You've learned fundamental principles about constituent engagement and about the intersection of QI and implementation science. And now we're going to help you to bring it all together and think about designs that you can use and processes that you can use in your research. We are led by two fabulous implementation scientists this afternoon. We have Nanette Benbow, who has an appointment in the Institute for Sexual and Gender Minority Health and is also core faculty at CEDIS, and Sarah Helseth, who's core faculty in CEDIS and is also our faculty director for this reading course and who's been responsible for a lot of the heavy lifting and organizational prowess of the course this year. So wanted to also shout that out and thank her publicly again for her exceptional service. And I'm delighted to turn it over to them to teach us all about implementation process and design. Please stay tuned. We will be going to your small groups today. We haven't done that the last two sessions because of the nature of the panels. So we'll be doing about half didactics, half small groups, and there are some important announcements at the end of this didactic. So please stay tuned with us throughout the rest of the time. All right, take it away, Nanette and Sarah.
Thank you so much, Sarah. So we are going to be talking to you today about implementation process and design. And really our hope is that this final didactic session will kind of tie together everything that we have spoken about with all of you throughout this entire course. So today we're going to be talking about how to approach implementation research design and make sure that you're centering equity. We're going to be talking about how to implement on its own, just the process of that, and then how to study implementation through different types of research design that kind of align with the questions that you have. And then how to accelerate implementation research through a series of studies referred to as hybrid trials. And then we're going to go into our small groups for one last time. So let's go. All right, so as I mentioned, these are some of the learning objectives. They align with the Paddock et al. Learning objectives that we've been working on the entire series. So we're going to be talking about how to balance external validity with internal validity and why it's relevant in D&I research. We want you to identify different measures and analysis strategies that will be relevant for your research questions. And we want you to be able to frame and analyze the context of D&I as a complex system with interacting parts. When we're talking about how to be more intentional about centering health equity in your work, we think that design is a really important time to consider the health equity implementation, the health equity implications of your work. So this is the D&I bridge. We've been talking about this bridge throughout the course. And in this case, we want to really think about how can implementation science be about anything other than equity? You know, we're talking about different gaps and the people who are falling through those gaps. And most often it is those folks who are marginalized or experience these inequities that we've been talking about throughout the course. And we really want to think in design about what is the most efficient and impactful design that we can do, where we're leveraging these different research approaches in a way that maximizes learning, but also minimizes opportunities for health disparities. And so these are some of the different design components that we would encourage you to consider including to help ensure that you are centering equity in whatever work that you do. So there's participatory approaches and partnerships, which we learned about several weeks ago with Corey Bradley and his fabulous collaborators. We've talked about ways to design recruitment to make sure that it's representative and that the work you're doing is generalizable. So the more focused you are in your work and the less effort you take to try and engage other populations, the more difficult that it can be to make sure that these findings will generalize to all people, especially those who are so often left out of research. We also want you to be thinking about intervention design and interpretation to make sure that you're evaluating your data, not just did it work overall, but then also going back to look and see, did it work better for some than others, and looking back at your design and really considering how you might address those potential inequities or those evidenced inequities, depending on kind of where you are in your process. And then the last one is thinking about dissemination of research findings and community benefits. So too often research is siloed away from those out in the community and those engaged in clinical practice. And we really need to take ownership of disseminating our findings so that we're not just sharing them with other scientists, we're sharing them with those in diverse communities who would benefit most from this work. All right, I'm going to hand it off to my fabulous collaborator, Nanette, and she's going to tell you about the implementation process.
Thank you, Sarah. All right. So you all have already heard a little bit about the implementation process, but it's really important because before we can research implementation, as we look at designs, we first need to understand how to implement and kind of what the timeline and process is. Next. So this is a little bit of a refresher from week 2 with a little bit more detail. You all looked at theories, models, and frameworks, and part of these, a key component of the theories, models, and frameworks are process models, and that is basically specifying the steps, whether it's stages or phases, in the implementation process. That is translating evidence-based evidence-based interventions into practice. And the aim of the process models is to describe and guide the process of translating research. And it really is the how-tos. So let's take a look at that a little bit more. Next. So EPIS stands for exploration, preparation, implementation, and sustainment. And you may begin at the beginning, and you may start at the very beginning and see the whole thing through, or you may come in at different points. But it's important to keep this whole picture. So the exploration phase is to understand what the needs are of your setting, and what is the best evidence-based practice to address those needs. Through that, you're going to want to take a look at adoption decisions to make sure that there is interest in really taking up that intervention. Then comes the preparation phase. You know your evidence-based practice, and now you need to plan. And you're going to need to talk to a number of people to make sure that everybody who needs to be involved is involved during the preparation phase. And to make sure that everybody who is involved is knowledgeable to be able to begin implementation, you'll probably have training, coaching as part of that. During the implementation phase, you really want to make sure, and maybe a lot of you have already experienced that leadership and support, infrastructure support is really key to get the evidence-based practice in place. And as that is happening during implementation, everybody's trained, ready to go, and you want to make sure that that is being delivered with fidelity. And really, at the end of the day, we're doing all of this so that this evidence-based practice yields the benefit that it has, and that is sustained over time. And that will require kind of looking at evidence-based quality assurance. Next. So EPIS is a process phase, but it is also a determinants framework. It's a bit of a 2-for-1. And this is really important because it actually acknowledges, it covers similar things to CFR, but it acknowledges that there will be different barriers and facilitators at each one of these stages. So you might find that you are, during exploration, there'll be a lot of things that you might encounter that you're not going to encounter doing active implementation. One, because you took care of them, and two, because you're at another phase. So it's really helpful to try to understand what you might encounter at each one of these phases. Next. So, great. Now we're going to dive in. I was caught by the research. We're going to now look at study designs. Next. And with the little time we have, we will be giving a high-level overview of what is a very rich conversation and lots to learn about study designs. I have highlighted in dark purple one of our seminal papers that really describes implementation research designs. There's a lot of resources, and we also have a link of a whole set of a reading list for you all to look at. And we'll just highlight some of these things. We'll be guided by the seminal paper. Next. I did want to highlight that a lot of work has gone into this presentation that we have in a lot of the content. I'd like to thank our colleague JD Smith, who got us going on this process. Here is a link to his webinar with all the detail all the detail that we will just really start uncovering today. So lots of resources for you all to learn more. So I just wanted to ground you a little bit into implementation research. So where are we now? You've learned a lot of things. Now we're actually into the implementation research phase. And you all already know it's the scientific study of the use of strategies. And really what we want to do at this phase is identify, develop, and test strategies to overcome the barriers and facilitators to adoption, adaptation, integration, sustainability, and scale up. So on our highway, we are now in the, has the EBI shown effectiveness? For the most part, yes. And we are now kind of in these green lines and are going to talk about how to think about this and how to study this. Next. So again, you all probably have this very clear, but I find it's really important to highlight implementations research shift in focus. The shift in focus is really is very telling and is going to help guide your design. So we're no longer focusing on the client and the health benefit. We're now focusing on the systems that are implementing and what can help most systems be able to do the thing. So we're evaluating systems ability in the process of improving quality, quantity, speed, and delivery in real-world contexts. Next. Next. So this change in focus, if you think of all the characteristics and challenges of implementation research trials, this change in focus is really key. We are now weighting external validity over internal validity. We want to minimize disruptions to and burden on the systems. Remember, now we're studying the systems. We don't want to be onerous and be in their way as we're trying to do this. Randomization is going to occur at higher levels. Remember, as we're looking at these systems, there are going to be multiple levels, provider, clinic, county, and we're going to be randomizing at these different levels. There are smaller units. We're talking about sites, not 1,000 clients anymore. There's going to be nesting within these various levels of the system. And of course, there's going to be interactions between them. So we're going to want to try to capture all of that. And we'll be using experimental designs to actually test the implementation strategy. And we're going to manipulate that to be able to understand the strategy's effectiveness. Next. So considerations that you need to make for a study design choices. There's 3 things that are really going to help inform you. What is your research question? What type of evidence do you want to get? And on what level do the strategies and EBIs operate? Oftentimes you're in a multi-level system, but the strategy could be focusing on different parts of the system. So you'll want to keep in mind what those are. And all of these will inform your study design, and you should make sure that you kind of have all of these answered. And if you could have effectiveness data or some evidence that will be addressed in hybrid designs, which Sarah will talk about shortly. One important reason for answering these questions is that it is going to have a lot of implications on the sample size and what you will be analyzing. Next. So choosing a design, what design type is needed to answer your question? Again, you're going to want to consider the level of the system that you're studying and what the primary outcome is going to be. You want that to be aligned with the level of strategy. So if it's at a provider level, you want to make sure that your primary outcome is addressed for that level and for that group. You are going to want to consider if you have sufficient units to answer your implementation research question. Remember, in general, you'll have smaller units, smaller number of them. So you're going to have to make that consideration as you choose your design. You'll want to be able to answer whether you can randomize the units. That is not always possible in the real world, but you may want to plan things so that that is possible, or some way in which you can do it without disrupting. And you're going to want to make sure if implementation as usual is an acceptable comparison to your community or clinical partners. So that will determine on whether it will be determined on whether implementation as usual is already working and you want to improve it, you want to enhance something, or whether you're totally replacing implementation as usual and you want to compare it with options. So really important to consider whether that is one of your comparators. Next. So when to use? There are a number of approaches you can use. The paper really kind of goes into detail and all of these different possibilities, observational studies, within site designs, between site designs, within and between, and hybrid effectiveness designs. I'll be covering the first two. So observational formative research. Next. The purpose of these is really to understand context. What is it that we're studying? What are the key elements? What are we trying to address? What barriers are we trying to overcome? And you want to have a good understanding of that. So observational studies, you're going to want to describe the outcomes of interest and kind of their antecedents in the context in which they exist. And they're very useful for evaluating real-world applicability of evidence. And remember, real world is where we're at in all of this. Formative evaluation, there's a lot of things that you're going to want to try to understand in the process. You want to involve stakeholders and experts to help you understand it. You want to identify what are kind of barriers and facilitators that you might encounter along the way. And formative evaluation will really help you understand the context of implementation and really kind of help you inform on selecting and tailoring strategies. Contextual assessments you'll probably really want to do as part of your process. You're going to want to look at capacity, and basically you're going to want to understand the barriers and facilitators. So here you will use CFR to try to understand the barriers and facilitators and capacity to align with the evidence-based practice. And you're going to want to describe and quantify characteristics of the implementation context. You really want to have a really good understanding of where your intervention will be implemented. And sampling is, I just want to highlight how sampling is critical here for achieving appropriate representation. Remember, we're in the real world and we want to be able to produce generalizable knowledge about that real world and that particular setting. So you're really going to want to keep in mind that you want to have representation as best as you can. You want to have a good representation of providers in the real world, of leadership, of managers, and of context. So really try to, as you're gaining feedback and looking at barriers for facilitators, that you're hearing from everybody that's involved. Next. Within site designs, I'll go through this very quickly next. These are, you've probably heard about, they're pretty common. Post design, you're only measuring outputs at the end. This is really common in quality improvement. Pre-post design, you'll have two key observation points, one before implementation, one after implementation of the evidence-based practice, and you'll want to see if there's any improvement or changes. And interactive time series is basically more than 2 points during the implementation stage so that you're able to compare, you know, are different sites able, are they all acting the same and able to implement kind of in similar time frames? Some might be able to start sooner, later, might have hiccups along the way. So an interrupted time series might really be able to help you understand and differentiate implementation across sites. Next. I'm now going to pass it over to you, Sarah.
Fabulous. I'm going to be talking about between site designs, which really the goal of these designs is to allow you to compare implementation and different implementation strategies. So sometimes you might want to be comparing a novel implementation strategy versus routine implementation. That's like kind of the equivalent of treatment as usual, implementation as usual. And sometimes sites are willing to try that and sometimes they're not. So that's kind of a decision you come to in partnership with them. More often we see comparative implementation where we're testing two novel strategies against one another. And I did want to note here, there was in the draft slides we got, there was the 7 Ps, and I decided to provide this little image to let you know these are the one example of kind of when we talk about the thing. And so you're going to be testing implementation of one of those things and comparing how you implement it. Common group-based designs are typically, you'll hear about cluster RCTs, but where the units, like Nanette mentioned, are at the higher levels. So instead of thinking about randomizing at the patient level, we're randomizing at the clinic level or the hospital level or the hospital cluster level. So if it's a system that has lots of different hospitals, or sometimes even at the county level, if we're talking about public health. And as we mentioned, we're going pretty quick with this. So some of the different things to consider are kind of which research questions you're interested in and what information you're seeking. So you want to make sure that whatever you're finding, you're contributing to generalizable knowledge. That is a goal of implementation science. As I mentioned earlier, we were talking about novel versus routine practice and head-to-head comparison strategies. Oftentimes within head-to-head comparison, you do use randomization because that can increase that internal validity. Sometimes sites are not willing to be randomized or not interested in that because they want the thing and they want to be guaranteed to get the new, intervention or the new implementation strategies that are more enhanced. And so later on, we'll be talking about rollout designs, and that can be kind of a nice way to give everybody something. They just might get it at different time points. We also have incomplete block designs, which can get a little tricky because not every group or not every block will receive every implementation strategy or every intervention, depending on whether we're talking about effectiveness or implementation. And so then it can sometimes be difficult because you can't make direct comparisons because not every group receives everything. And then we have these smart designs that allow implementation strategies to be evaluated while responding to a clinic's challenges to reach that level of impact. And I included a link there if you'd like to read more about smart strategies. I added this slide, and I'm going to preface it by saying that I am not a statistician, but I saw someone present this last week, and I thought it was really valuable information, and I wanted to make sure I shared it with you all today. So powering for these large multi-site trials where we're randomizing at the multi-level units rather than at the individual unit can be sometimes a little bit tricky to power for. You have to partner often with a statistician with expertise in this area. But what we found is that statistical power can decrease as the variation in the treatment effect across study sites increases. And I like I said, I'm not a statistician, so I'm going to end with the main point here, which is that in general, you can increase your power more easily by having more clusters. So whether that's more sites, more counties involved, wherever it is that you're making that cluster randomization, having more of those things is more important than the number of individuals within each site. And that's a really tricky thing to kind of wrap your head around, because so often we're taught statistical power is your sample size. But for us here, we're really powering for the sample being the multi-level site. So it's really powering at the higher level there than at the individual level. Now I'm going to be talking about hybrid effectiveness and implementation trials, which is so often where I live and do my work. But I really loved this mental reframe that these are not really research designs in and of themselves. Like, you choose a randomized cluster trial, but then you might be also calling it a hybrid effectiveness implementation trial, because it's really about how you describe your aims and your outcomes of interest and what your priorities are in the study. So it can be very important to, as a way to communicate the objectives of the research. We have a collection of stellar publications by Jeff Curran and his colleagues over all of these years. I believe you guys read the paper by Sarah Landis, which is a really lovely introduction. Another one that's really valuable is the 2022 Reflections on 10 Years of Effectiveness Implementation Hybrid Studies. So I would encourage you to take a look at those if you're really interested in this design. So why hybrid designs? The goal here is really to maximize what we're learning from studies, getting the most bang for your buck. And that can be achieved by blending intervention, effectiveness, and implementation research questions. We're not waiting for perfect effectiveness data. We're basically pushing the research down that subway line, because we're trying to get these things that we think are promising or that will work or have good evidence, but maybe not in this particular context or with this particular population. And we're saying, we feel like it's pretty good. Let's push it out there and try to get as much effectiveness data as we can, while also studying how this is implemented. And we can backfill that effectiveness data while we are testing these implementation strategies. And another thing that's really important to consider is, how do these intervention outcomes relate to the levels of adoption and fidelity? So it's saying, was the study effective or not effective because of those contextual factors? Like, maybe a study was not effective, maybe the intervention didn't seem to be effective, but when you dig deeper into the data and you look at the levels of adoption or fidelity, you might see that some of the sites that had low adoption, people weren't doing it. It's hard for an intervention to be effective if no one's doing it, right? Or maybe they were doing it poorly and they had low fidelity. So collecting both of these types of data in a single context can be really valuable. So we're talking about 3 types of hybrids: a hybrid type 1, a hybrid type 2, and a hybrid type 3. And really what we're focusing on here is, where is your primary aim? So for hybrid type 1s, your primary aim is effectiveness. For hybrid type 3, your primary aim is implementation. And for a hybrid type 2, you're really interested in both of those things. So just to reiterate, when we're talking about hybrid trials, a hybrid type 1 weights intervention effectiveness more heavily than the implementation outcomes, but it's kind of taking advantage of a natural opportunity and saying, we're really interested in effectiveness here, but we also want to get information that'll help us build subsequent trials or help us plan for the next stage of this work. So you might be conducting an example of like reach, or maybe you'll be looking at qualitative data to get feedback from people about what worked and didn't work with implementation, so that you can plan for the next stage of this work. We also have, as I mentioned, hybrid type 3s, where we're less interested in effectiveness, but sometimes we'll still collect it anyways because the opportunity is there. And you often see this, especially with like electronic health records data, because really here the focus is on finding out which of these head-to-head implementation strategies or implementation plans with combined strategies were more effective at implementation. So sometimes the outcomes here, you might be looking at how quickly adoption happened at one strategy site versus another strategy site. You might be looking at reach, or you might be looking at some of those other outcomes that we're always talking about here. So again, you're collecting that effectiveness data, but really the objective of this work is to find out which implementation strategies were more effective in this specific context that you're working. And then we have the hybrid type 2s, which is kind of the everything everywhere all at once. And these can get a little bit tricky. And sometimes I do think we see fewer of these hybrid type 2 trials. Oftentimes we see people jumping type 1 to type 3 between each phase of their work. Or you see people going straight to type 3, depending on how much evidence there is. But the function of a type 2 really says, I'm interested in both, and I want to know how well one works over the other. So sometimes, depending on the scope of the work, you might see somebody testing a new adapted intervention. So maybe they've made some changes to the intervention, but it still had really strong effectiveness. So in addition to testing the effectiveness of that adapted intervention, they're also maybe testing implementation strategies. And as I mentioned, these can get a little bit tricky, and the design component can be very important when you're really interested in both of these outcomes. All right, now we're leveling up and going to within and between site designs, or what we call rollout designs. And this is most often seen on really large scale trials in my experience. And I do also want to mention, I can't remember, oh, it must be on the next slide. Northwestern has really been a leader in this space, especially one of our collaborators, Hendrix Brown. So you might see his name on a lot of papers talking about those rollout designs. But basically a rollout design is where sites begin as one implementation condition and they move to another. And the benefits of these rollout designs are that they reduce some of the logistical demands. So like, let's say you have 30 sites. How would you plan to train and staff and launch 30 sites, right? Like your research team is your research team. Sometimes you're funded for like a handful of RAs. And yeah, they're, you know, very scrappy, but they probably can't go out and onboard all of those sites and deliver that training at the exact same time in a short period. So a rollout design allows you to space that period out while capturing some initial data on your implementation effectiveness outcomes, as well as your pre-implementation outcomes if you're doing a hybrid design as well. And then eventually implementation launches at that site. And then for the sites that already had their implementation phase, you might see a sustainment phase where you've withdrawn those implementation supports and you want to be able to see what this looks like when they're not receiving, ongoing consultation and support. And that gives you a sense of kind of what things will look like when the trial is over. So I was trying to look for, yes, go ahead.
I think we're running out of time.
Okay, great. I'm almost done. So this is a really lovely visual that'll kind of help you see. Time is on the bottom. And then each of these kind of rows is a different cluster. So classic parallel cluster design, everybody gets the same dose the whole time. But then in the stepped wedge, the bottom two, you see kind of that roll on where implementation goes at each cluster of sites over time. And our case example that we've talked about this entire series was the screening and brief intervention and referral to treatment. And what I really wanted to show here is to talk to you about how, we've talked about each of these stages where we identified the innovation, we looked at determinants through contextual inquiry, we've ID'd the strategies we'll use to address the barriers that we've identified, and we selected the outcomes we want to reach. So in showing you this IRLM, it doesn't tell you much about what the study's design looked like. So I thought I would talk with you about that right now. So IMSPERT was a rolled out stepped wedge trial. And so we see here that each cluster, which is essentially like each row, onboarded to preparation and implementation. And then as each site rolled on to implementation, a new cluster rolled onto implementation, the next one rolled into the sustainability phase. And if you want to read more about this, what I thought was really lovely is that they had this wonderful graphic that showed you how each of their implementation strategies, didactic training, performance feedback, and coaching, it shows you when in the preparation, implementation, and sustainment phases, different activities happen to kind of give you a sense of what this rollout looked like. All right. Believe it or not, we did it. You are done with our implementation science reading course. Thank you all so much for another great year. And now we're sending you off to the Emerald City to go out and do implementation practice and research. But before we end, I did just want to end on one announcement. Our next and truly final session is an in-person networking event. We're going to be providing lunch, and it is Wednesday, May 21st from 11 to 12 in the Simpson Query Auditorium. I've highlighted, I should say Emma, our fabulous administrator, has highlighted right there where that is. We'll also be sending out an email reminder, and I believe probably an RSVP just to get a sense of who to expect. And with that, I'm going to end on this. We love to collect information from folks to make sure that we can refine this course. We meet and take time to update it every year. So please fill out your post-course survey. Let us know what you liked, what you didn't like, what you think we should do for the next cohort of this program. And we'll be sending out those certificates as well once we receive those surveys. So thank you all so much for your time. And now I think Emma is going to launch us into our small groups.